I want to share the story of the first time I diagnosed stillbirth. I was in residency and a patient came in for decreased fetal movements. She was taken to the room and I did an ultrasound, couldn't find the heartbeat, and I told the patient the news. She had no expression on her face. As I finished up and I left the room, I heard the most gut-wrenching scream. It was like a wail that just like pierced. Ugh, I will never forget that sound. And I remember after she delivered, the nurse said that the baby looked so perfect that she wanted to start resuscitation. It was just a terrible situation all around. And that has always stuck with me. And I always think about that patient when I counsel people about risks of stillbirth. And so the reason I thought about this today was because I came across a video where the caption said, OBs throw around the dead baby card willy-nilly. This is one of the few times where I will say that I am sure all of my colleagues feel this way, because we have all had situations like mine with diagnosing stillbirths. We have all taken care of patients who have had losses, and that is where we are coming from when we counsel about this risk. I don't ever want to have another patient make that sound. That still sticks with me to this day, 12 years later. So this messaging that is perpetuated, that OBGYNs are these heartless robots that just want to push induction so you end up with a C-section, is really harmful. Like, this is not advocacy. You can tell people that they can go past their due date, they can go to 42 weeks without painting this kind of picture when it is not where the majority of us are coming from. How some of my colleagues may counsel and relay the information about these risks is a different story. That may leave a lot to be desired, and maybe that's where a lot of the static comes from. But it doesn't take away from the fact that the intention is not malicious. It is usually to prevent a terrible outcome. I feel like people need to ask themselves, how is this helping, right? Can I present this information, empower this patient to be their own advocates in a way that will foster trust between them and their provider, and still help them not get taken advantage of? And I feel like not enough people ask that question.